Hello everybody, welcome to New Hope Fertility Center IVF orientation class. This is an introduction phase to IVF. So every single female needs to know that a few facts about infertility. Every single woman is born with a maximum number of eggs, and that will deplete at menopause. Women will no longer ovulate, so there is no more egg fertilized. Ovarian reserve, this is what we are referring to, current supply of eggs. We do use few criteria such as hormone FSH, follicle stimulating hormone, and the ultrasound in order to analyze and look at the number of follicles and the current supply of eggs at a certain stage of women's fertility phase. Not every single woman will have exactly the same number of follicles or the actual egg supply. It will change drastically throughout the time. Every single female will have a different reserve, whether she is 35 or 45. You cannot compare yourself to other patients, and this is very important to remember when you're going through IVF. And not every follicle will have an egg. We need to have certain criteria for the follicle in order to be mature and contain an egg. So let's talk about follicle. What is a follicle? As you see at the picture on the right, there is an ultrasound picture of a single ovary that contains multiple antral follicles. Antral follicle is small young follicle that's supposed to contain one egg. At this stage, it's immature egg in each follicle. However, once the female will go through a menstrual cycle, closer to the ovulation, only one follicle will dominate and mature in order to release an egg to get ready for a fertilization at the end of the cycle. Ovarian follicles are the basic unit of female reproductive biology. So each of them contained a single egg, which is also known as an oocyte. These structures are periodically initiated to grow and develop, culminating in ovulation of usually a single egg. Follicle developing cycle in the ultrasound is very important to follow every day, once in a few days, to monitor. So monitoring represents both blood work and ultrasound, usually throughout the entire protocol and throughout the entire IVF process. Again, it will change, not drastically, maybe day to day. However, it is very important to have a standard and structured monitoring in order for a doctor to understand when to change medication dosage, when to change instructions, and of course when patient is ready to retrieve. So what is IVF itself? IVF stands for in vitro fertilization. So that is the process that represents fertilization of the egg outside of female's body. So we retrieve an egg and we fertilize it with a sperm in the laboratory dish. So it's an outside of the body fertilization, where later on egg becomes an embryo where we can transfer it back into the uterus. So that is what IVF is about. In order for you to be ready for IVF, we need to go over a few aspects. First of all consent forms must be properly signed and witnessed. Every single patient will have a different protocols, whether it is egg freezing, embryo freezing, PGS, which stands for pre-implantation genetic diagnostics on the embryos. The consent will differentiate based on those protocols. If you are doing an oocyte freezing, you will require to sign only two forms, egg retrieval and oocyte freezing consent forms. If you're doing embryo freezing, you are required to sign three forms, egg retrieval, assistive reproductive technology, and embryo cryopreservation consent form, in addition to a PGD consent form if you're testing embryos for any genetic abnormalities. All the consent forms must be signed and witnessed in front of the nursing staff, could be any clinical personnel or whoever works at New Hope Fertility Center, particularly to witness your signatures, whether it is you and your partner. If you are not available for the consent forms in person so we can witness the signatures, you are allowed to sign them outside of our facility, but you are required to notarize it. Then we can accept the forms. All the forms must be signed prior to your egg retrieval day, and we can sign it any day during the weekday or the weekends as long as we have a nursing staff available on that day. You can just let us know ahead of time that you are coming in for the appointment and sign the consent forms. Required testing should be completed before monitoring begins. We will go over specific tests that are required a little later on a separate page, but every single patient and partner that are going through IVF, if fertilization is involved, we are going to test both patient and the partner for significant tests of STDs and, of course, genetic testing. Monitoring. So what is the monitoring again? This is the use of the ultrasound and or lab tests to monitor ovarian follicle development and hormonal production. Again, we watch your ovaries to determine the perfect time of egg development. So we, over the course of 2 weeks or more, every patient and the partner required to go through testing that needs to be completed before egg retrieval. Monitoring begins at the day 1 of your menstrual cycle or maybe earlier, which involved ultrasound and lab results. In that way, we monitor ovarian follicle development and hormone production, and we watch your ovary to determine the perfect time of egg development. Also, any prior authorizations should be initiated before the treatment. Prior authorization could be related specifically to IVF medications and also IVF procedures. Particularly IVF medications, it is very important to understand whether your insurance company required prior authorization. Any prior authorizations should be initiated before treatment. Some pre-certifications for your IVF medication may take up to 3 weeks. Please notify nursing staff of your pharmacy benefits to direct your medication prescriptions to the appropriate pharmacy. You can contact nursing department and inform us which pharmacy do you prefer for your IVF medications. Please keep in mind that certain medications, specifically injectable medications, may require to go through specialty pharmacies. And you can call different pharmacies to find out which insurance prefer which pharmacy in order for us to, again, send prescriptions to the most appropriate pharmacies. Certain insurances require certain pharmacies to be used. Again, regular medications in terms of tablets, pills, you can acquire at any local pharmacies such as Wayne Reed, CVS, any retail pharmacies will have the pills. However, injectable medications require to go to a fertility specialty pharmacies. So again, feel free to request a form from the nursing staff or any clinical staff at New Hope Fertility Center. And we also can go over the list and whichever pharmacy would be the most appropriate for you in person. Now let's talk about required testing. Every single patient is required to go through the infectious disease panel and make sure that you're healthy and you're ready to have an egg retrieval. So female patients, which you can see on the right, required certain tests. CBC is standing for complete blood count, HIV 1 and 2, hepatitis B, hepatitis C, varicella, rubella, syphilis, gonorrhea, chlamydia, pap smear, blood type. Now keep in mind that everything on that list except pap smear and the blood type required to be updated once a year. So if you have any tests done somewhere else, whether it is your PCP or OBGYN, and they are within 1 year, please bring your records with you next time you're in the office and provide it to the clinical staff so we can go over the list and ensure that you have those tests done already in order for you not to do them again. Pap smears, as long as you have them within the past 3 years, we will accept the records again, and blood type, of course, will not change throughout your lifetime. Any records that you have, as long as the records have your name, date of birth, and date drawn, we will accept. Now for the male patients on the left side, you can see as well required testing. All of them should be done within 1 year. If you and your partner desire to do all the tests at New Hope Fertility Center, we will be able to do so any day during the week or the weekends or at your next monitoring day. Genetic testing. Genetic testing is required for female patients only, whoever is going through the fertilization and embryo freezing. Females who are doing egg freezing are not required for genetic testing, and also females who are using donor sperm, unknown donor, they are not required to do genetic testing. So genetic testing, if you did them somewhere else already prior to visiting New Hope Fertility Center, they will not expire. You can bring any records if you did them at another facility. Again, please make sure those are official records with your name, date of birth, and the date drawn. So let's talk about IVF process. So what happens after you're beginning your IVF? Some of the doctors may require you to be on certain protocols as a preparation protocol. As you can see, it may require some medications for a month before you actually consider IVF cycle to start. So what does that mean? We may ask you to start with birth control pills for about 10 to 14 days to prepare your ovaries. We may ask you to start with estrogen and birth control pills again, and that is prior to start IVF medications. Once you stop the preparation medications, the following day is assigned as a day 1 of your menstrual cycle. So this is not natural bleeding day. You will assign a day 1 to that particular day once you stop the pill. However, if we're going naturally, any day 1 of your menstrual cycle should be counted as a full flow. Spotting does not count as a day 1 of your menstrual cycle, just for your information. Once you start your cycle, you can call or email nursing staff that you started your period, and we can move on with the process. From day 2 or 3 of your menstrual cycle, you're required to do a baseline blood work and ultrasound in order for the doctor to make a decision when medications should be started for the IVF process. Between day 3 and day 12, you will undergo monitoring phase, which requiring sometimes daily office visits for the ultrasound and blood work. The time frame depends on, of course, on your body's response to medications. For example, if the female has a regular cycle of 28 to 30 days, she gets her period every 28 to 30 days. You should expect to ovulate around day 14, meaning from day 1 through day 14, you will be monitored. From day 1 through day 10, monitorings are not as often as from day 10 through 14. And the reason for that, follicle will grow much faster towards the end of the cycle. It will get bigger, so we have to monitor you more closely in order for us not to miss the important day, which is known as trigger day. So what is trigger day? Again, it's around day 12 of your cycle or after day 12. The longer your cycles are, for example, if it's not 28 days, it's 35 days, your ovulation will be slightly delayed. Your ovulation may fall on day 14 or 15 of your cycle. Again, never forget, every female is different, every body is different. So the trigger day is very important. This is the trigger injection that will induce your ovulation. So pretty much within 36 hours, you will be scheduled for an egg retrieval and you will ovulate. Once you use an injection, it induces the follicle to release an egg. So we know exactly when to take the egg out of the follicle before you ovulate. That is very important to be available during this process, and this is the time when you will start monitoring every single day. How do we make a decision when to trigger? There are a few criteria that the physician will decide based, of course, on your size of the follicle and the level of the estrogen. It is very important for the egg to be mature before we decide to be triggered. The goal is to have as many follicles as possible, and the follicle must be 18 millimeters or larger in order for the egg to be mature. Also, the level of the estrogen will correspond to the size of the follicle. If you have a follicle of 18 millimeters or larger, we should expect a certain level of your estrogen. Particularly, it should be at least 150 to 250 units per follicle. Again, once the follicle matures, the estrogen will increase dramatically, and we know exactly this is the ideal time to trigger. Once you are triggered, again, within 34 to 36 hours, you will be scheduled for your egg retrieval. On the egg retrieval day, you must be presented to the office half an hour before a scheduled procedure unless notified by the nursing staff differently. All the consent forms must be signed, screening tests must be done by then, and of course the egg retrieval is done under anesthesia, whether it is IV sedation or you were requested a local anesthesia. Two different approaches depending on how many follicles is expected to be retrieved. There are more criteria than just the amount of follicles. Number one, of course, it's a patient's preferences. You will discuss with the nursing staff which one would be ideal for you specifically. Again, every patient is different. Your pain threshold, the amount of follicles, whether you did it before, are you allergic to lidocaine, which is a choice of topical analgesic during the local anesthesia, and of course, whether patient has maybe fibroids or the location of the ovaries sometimes could be very deep. and therefore it could be very uncomfortable for the patient even to do the regular ultrasound. So if that is the case, we need to discuss that with the patient. Maybe IV sedation will be a preferred way to do the egg retrieval. The patients who are undergoing IV sedation should not eat or drink 6 hours prior to the procedure. The procedure takes approximately minimum 5, maximum 20 minutes, depending on how many eggs are recovered from the follicles. Again, the more follicles you have, the longer procedure may take. In addition, if you're scheduled for an IV sedation, it takes a little longer because the anesthesiologist will come into you, will sedate you first. We want to make sure you're asleep before we proceed with the procedure. And of course, to wake up after the procedure, you will need a little extra time to go to the recovery room, of course. And for the IV sedation, patients' recovery time can be up to 1 hour. It's actually a required time, 1 hour post-operative procedure, in order for the nurse to make sure that you do not have any pain. She will take your vital signs every 15 minutes throughout that hour to make sure that you do not feel uncomfortable and you're okay to go home. If you're doing IV sedation, you're required to have someone to escort you home. You cannot leave alone. If that is the decision that you make, you must sign an additional consent form to leave unaccompanied. On the day of the egg retrieval, if the egg is inseminated with the sperm, we are required partners to be present in the office for a sperm collection. If you're using donor sperm, frozen sperm, please ensure that the clinical staff is aware and we have a specimen ready in our office, preferably a few days prior to the scheduled procedure. Sperm collection. Sperm is generally collected from the male here at NHFC, but may be done at home as long as we receive the sample within 1 hour. Your partner must be present on the day of the procedure. We have a designated collection rooms on the same floor. Your partner must bring his photo ID to present at the time of the collection before he signs the consent form. Please be sure to confirm your arrangements if you are using frozen or donor sperm or bringing the specimen from home. Partner could collect specimen at home. You can request a special home collection kit from the nurses prior to your procedure, a couple of days before that, and we will explain to you how to use it. Frozen or donor sperm must be in our laboratory prior to beginning the medications, ideally. However, not every single specimen must get to our office at that time. Exactly give a couple of days before the egg retrieval. We want to make sure that it was delivered on time. If we do not get a specimen on the day of the egg retrieval, the egg will be frozen. Specific instructions for semen production will be provided on the morning of the egg retrieval to your partner. Please arrive at the assigned time to ensure the sample is prepared to coincide with the egg retrieval. If you have any issues with the time of your partner arriving to our office, please feel free to contact us the day before your procedure and we can arrange for that. Now, once we collect the egg and the sperm, both will be processed in our laboratory before fertilization takes place. The fertilization could be done via ICSI technique, which is known as intracytoplasmic sperm injection, versus the natural approach, which is known as conventional insemination. The difference is that ICSI usually done for certain reasons. Number one, it's a poor semen quality or quantity. We don't have enough volume. B, history of poor fertilization with the conventional insemination, which is natural insemination. And C, when we're using frozen sperm, ICSI must be done. And D, when fertilizing frozen eggs. Again, we are actually dealing with cryopreserved specimens, so that will improve the rate of their freezing. Once we fertilize the egg, what we are looking at next day fertilization outcome. At this picture, we are looking at the normal fertilization process. The embryologist is looking for a proof of normal fertilization where they are able to locate two cells that are called two pronuclei. So you will get the report from the embryology whether the egg was or eggs were fertilized normally. We are looking for 2PN report. The egg may not fertilize normally, which you will also get via report, or there could be a pending fertilization, which means we have to wait for 1 extra day to see if the egg gets to fertilization point. Anything after the fertilization point, the egg starts to divide into 2 to 4 cells, as you can see on day 2, 6 to 8 on day 3, And day 4, at this point, we are no longer able to understand how many cells there are. There are usually more than 40. So there are different stages such as cavitating morula. And by day 5, we need to see the most advanced stage, which is known as blastocyst. Keep in mind that after your egg retrieval and fertilization, egg and sperm will make an embryo. Your embryo will be closely monitored under the microscope for 5, maximum 7 days. If the plan is to freeze the embryo at the blastocyst stage, the egg is given maximum 7 days. If on day 5 we have a blastocyst, it will get frozen. If on day 6 it gets to a blastocyst stage, it will be frozen on day 6. And if on day 7, then it will be frozen on day 7. If by day 7 we do not have a blastocyst, the embryo will be discarded or donated to research, whichever you will choose based on your consent forms. Why do we freeze embryos? As you can hear, we always discussing embryo cryopreservation. So we do recommend to freeze embryos on either day 3 or day 5 after fertilization for the following reasons. Number 1, genetic testing of the embryos. If we need to genetically test the embryo, we have to freeze the specimen in order for us to wait for the genetic testing to come back. It takes about 7 to 10 days for the results to be back. While you're waiting for your next menstrual period, and by the time you're ready to start your next cycle, we will know the results of the genetic testing. If we have a normal embryo, great, we can move on with embryo transfer. If we do not have a normal embryo, we can always move on with the next IVF cycle. So you're not missing anything. Number 2, you're not ready for the pregnancy. What if you would like to bank more embryos, or you prefer a specific gender? You would like a girl or a boy, and genetic testing showed you something that you're not willing to transfer. Also, banking of the embryos. Cases require banking of the embryos again, such as genetic testing, or the reserve is very diminished and you would prefer to bank as many as you can before you can move on with the transfer, or you desire pregnancy later on in your life and you are not ready to become pregnant right now. Number 4, it's inadequacy of the uterine lining. Not every single patient will be ready for the implantation of the embryo. Patient may require certain hysteroscopies, surgeries, or any additional testing in order to improve the environment of the uterus and to increase the chances of implantation. So we may need to take an additional testing or to follow additional protocol which may delay the transfer again. So in order for us to preserve embryo while we're waiting for that, we have to freeze it. Also, number 5, gender selection. Again, as I mentioned already, if we are looking for a specific gender, that may take a couple of cycles to achieve that. Embryo transfer. So the decision will be made by you and your physician whether to transfer the embryo on day 3 or day 5. If we have a frozen specimen already, for example, you have a day 3 frozen embryo, we will transfer the embryo after 3 days of your ovulation. First, you will be monitored again from day 1, starting on day 3 as a baseline, blood work and ultrasound, and we will monitor you until you ovulate naturally. So we are not doing egg retrievals during that phase. We are just monitoring you until you ovulate. Once you ovulate, 3 days later, the embryo will be transferred back into the uterus. If it's a day 5 embryo, that will happen 5 days later. You will need to begin taking estrogen, which is known also as estradiol oral pills, and progesterone suppositories in order to prepare the lining of the uterus for a better implantation. Again, once you ovulate, we will start both medications either 3 or 5 days prior to the implantation. The transfer is not painful and does not require any anesthesia. There are no needles involved and there are no restrictions, but it is recommended not to have intercourse for 2 weeks after the embryo transfer. You will be given more criteria and restrictions after the transfer, and of course which medications to continue. Usually you will be continuously taking estrogen and progesterone suppositories until you are back for your pregnancy test. You will return to the office within 7 to 12 days as recommended by the physician for a pregnancy test, which involves only a blood work on that day, no ultrasound. Let's talk about oocyte cryopreservation. It can be done at any age. It enables women to preserve their eggs for a later use, and it is a great option for women who are not in a relationship or not ready to get pregnant at this point, or they have a disorder that may affect their fertility in the future. So we will plan to freeze eggs, as many as we can, of course. The eggs are retrieved, confirmed to be mature, then frozen. No fertilization with sperm takes place. For one baby, we do recommend to freeze approximately 10 to 15 eggs. It may take one cycle IVF, but it may take 3 cycles of IVF. It depends on women's ovarian reserve, and again, everybody is different. In order to begin your IVF cycle, please contact New Hope Fertility Center on day 1 of your menstrual period. You can simply dial a main number to schedule your first appointment. If you do have an assigned day, then you are already scheduled by a nursing staff, and you can show up anytime between 8 a.m. and 2 p.m. On that day, you will have your blood work and ultrasound done. You will sit down with one of the nursing staff to go over your protocol, whether it is IVF or embryo freezing or egg freezing. We will discuss medications and the time frame of your protocols. You should be prepared for frequent monitoring from approximately day 10 through day 14. These are the days pretty much when you should expect an egg retrieval to happen. Each day you come in for the monitor, and you will receive a notification via email or telephone number, whichever you prefer, by the end of the day with your next instructions. Mini IVF, which is also known as minimal IVF stimulation, this is our treatment and a trademark minimal stimulation protocol. It involves use of oral tablets and small dose of injections in order to stimulate multiple follicles to retrieve multiple eggs at the end. Amount of follicles retrieved depends on women's overall ovarian reserve. For a mini IVF, we do expect to retrieve 6 to 8 eggs per cycle. Again, it may vary again based on every single woman's reserve. If you start with 10 antral follicles, remember the picture that I showed at the very beginning with the ovary and approximately 6 small black circles that represent follicles. So if you have 6 antral follicles on each ovary, that gives you a total of 12 antral follicles to start with. In order for you to retrieve and make sure that all of them will grow, we'll give you multiple medications to increase your FSH in order for each follicle to be stimulated. Please keep in mind that not every single follicle will grow to the maturity, and not every single follicle will have an egg inside. So you should expect with the start of 12, you may retrieve up to 8 or 10 eggs at the end, or maybe even less, or maybe all 12. But what you need to remember that you will never have more than that. Whatever is given by nature at the beginning of your cycle, the medications will ensure the same amount of eggs at the end. Minimal IVF stimulation involves less medication, specifically injections, in order to concentrate on a smaller amount of follicles and smaller amount of eggs retrieved to improve the egg quality. Many IVF medication protocol may include preparation with birth control pills first, which takes about 7 to 10 days, with a follow-up of injections such as Follistim, Gono-F, and oral tablets, Clomid and Letrozole, with the use of Ganirelix injections, which helps to slow down the ovulation process, and the trigger shots that include Avidril and Lupron. Next protocol, we will discuss ultra mini IVF. We use a minimal amount of only oral medications to start with in order to stimulate multiple follicles to grow. It is very ideal protocol for a woman with a reduced ovarian reserve due to the fact that female will have a less amount of antral follicles at the beginning of the cycle. And if we are to use only oral tablets, the production of the eggs towards the end of the cycle will be exactly the same whether you're using injections with pills. There is no reason to use both if we will retrieve the same amount of eggs. Again, we are concentrating on the egg quality, not the egg quantity. What is important to know that ultra mini IVF does not include injections in this protocol, again, to start with. As you can see on the diagram, you will see an injection here towards the end of the cycle, and again, keep in mind it's a trigger injection which will induce your ovulation. It will yield less follicles to grow. Again, remember, usually we would expect to see 2 to 4, maximum 6 eggs retrieved with ultra mini IVF protocol. The medication will be used oral tablets of Clomid and letrozole to grow your follicles with. This is your FSH hormone, and Avidril or Lupron as a trigger shot. Now, ganirelix to stop your ovulation. Most of the protocols of ultra mini IVF may additionally contain ganirelix to be used towards the end of the cycle. Females with the lower ovarian reserve have a tendency to ovulate slightly earlier, so in order for us to help the follicle to mature, we may administer ganirelix again towards the end of the cycle, not to promote the stimulation but to slow down the ovulation process, so maybe the smaller follicle may catch up to a dominant one in order for us to get more eggs retrieved at the end. And then last but not least, we have a natural cycle IVF. This is a natural stimulation of a follicle. Generally will yield only one dominant follicle, meaning one egg will be retrieved at the end of the cycle. Natural cycle IVF will yield one egg. However, this is the best egg that you can get because of the environment where the follicle is growing. It is very hard to control natural cycle as we do not use any medications to slow down ovulation. So we have to be very cautious in monitoring patient during natural cycle, especially towards the end of the ovulation. Cases where a patient may prematurely ovulate, and it is again very hard to control the ovulation. Therefore, sometimes after we retrieve the egg in the follicular phase of a natural cycle, as you can see later in the picture, after the egg retrieval happens, you do see injections and pills. This particular protocol, known as luteal phase stimulation, not every single patient will be ideal candidate for this protocol. This is only if patient have additional follicles to stimulate after the retrieval. Again, you're not supposed to ovulate twice in one cycle. Therefore, additional medications will be required to stimulate those follicles. And injections and pills will usually work 30% over time in luteal phase stimulation. However, if we do get to the point where we have to trigger you again for a secondary retrieval within the same cycle, we do use different medications. And this particular egg will not be different quality-wise from the follicular phase. It could be as good as follicular phase. Again, natural cycle medication protocol, trigger shots, as you know, Avidril and Lupron, and sometimes ganirelix to slow down the ovulation process. So let's go over medications. We will start with pills. Clomid, also known as clomiphene citrate. Please make sure that you're familiar with both brand name and generic name. Most of the pharmacies will release generic name medications to you, so if you are not sure whether it is the same medication or not, you can ask the pharmacist to confirm before you leave, or you can also call our nurse to confirm. Clomid stimulates the ovaries to produce follicles that contain the FSH hormone, follicle stimulating hormone. You should take it by mouth at bedtime, and it comes in forms of 1 tablet, which is 50 milligrams, half tablet, or a quarter of the tablet. We will prescribe to the pharmacy to dispense certain amount of medications and directions. The directions will be very generalized. Always follow our nurse's instructions. Never follow the instructions that are written on a bottle or the package of your medications. It could be different. You do not need to take Clomid with food. However, there are some side effects that you should be aware of. That's why we do recommend to take all medications, all IVF medications at evening time, before bedtime, right before you go to sleep. It doesn't matter as long as you keep time the same every evening. So the most common side effects from Clomid includes headache, dizziness, blurry vision, mood swings, and hot flashes. Welcome to IVF. If you do get blurry vision, it is very rare condition. You need to stop Clomid immediately and inform your doctor or nurse. Letrozole, also known as Femara, stimulates the ovaries to produce multiple follicles, taken by mouth at bedtime in forms of 1 tablet or half tablet. You do not need to take letrozole with or without food again. And major side effects include dizziness, drowsiness, headache, and hot flashes. Again, if you take it towards the end of the day, you go to sleep and you may not experience side effects at all. You will not experience all of them at the same time. You may have only a headache at evening or the following morning. However, if you do take certain medications and it does interfere with your daily activities, let us know if you're not feeling comfortable with any of the medications. Follistim, one of the major brands on the market for the injections. It's a synthetic version of the FSH, follicle stimulating hormone, and it helps to grow follicles. It's a subcutaneous injections, which means it's administered into the abdomen 2 to 3 inches away from your belly button. It is sold in different increments. The cartridges you can find in the pharmacy will contain 300 units, 600 units, and 900 units vials. We do prescribe maximum for minimal IVF stimulation protocols, which is 900 units. It should be enough for one cycle IVF. However, you may run out of 900 units by day 12 and you may need additionally 300 units. So you can just contact our nursing department so we can order more, or you can go back to the pharmacy and ask for the refill. Depending on the dosage prescribed per day, you may administer 75 units per day, 150 units per day, or even 225 units per day. If you do not know whether you can refill another 900 units of Follistim from the pharmacy, you may require only 300 units. You will need a new prescription. So you can contact nursing department so we can send a brand new prescription for 300 units. Keep in mind that Follistim does not have markings on the cartridge, so it is very hard to know how much you have left in the cartridge. You can just keep track of your medications and the dosages, how many you've been using, so you know exactly when you will run out of medication. It is very important in order for you to administer medications on time. Once opened, once you start the cartridge, you should be using that within the next 28 days, and please always refrigerate Follistim. Side effects, most common ones are bruising at the injection site, stinging, tingling sensation once you inject it from the couple of minutes after, and pelvic pain with headache. Gonal F is another version of FSH injections, follicle stimulating hormone. It is a multi-dose pen and stimulates the ovaries to grow and produce multiple follicles. Same notion again, once open, medication should be used within 28 days. You should refrigerate your injections. Common side effects, headache, upset stomach, ovarian cysts. Whether you are going to use Gonal F or Follistim, we do not prefer either or. However, your insurance may require you to use a certain brand over another. Again, please let us know, and it is usually okay to choose from either or. Ganirelix acetate, also known as Cetratide. Again, there are two major either brand name, which is Ganirelix, or Cetratide generic name. Whichever you use, we do not prefer either or, whichever your insurance covers. The most important to know that it is used to suppress the LH, which is a luteal hormone. It suppresses the ovulation process until the follicles are mature. Use cautiously. If you're allergic to latex, you can let us know. The side effects are headache, mild vaginal bleeding. Now, Ganirelix acetate is, as you can see on this picture, pre-filled syringe. Sometimes we do require our patients to use only half dose of the Ganirelix once, and the remaining half you would have to use the following day. Very important to know, pre-filled syringe, you cannot change your needle, so you would have to reuse this needle once again the following day. If you're no longer instructed to use the injection the next day, you should discard the syringe, and you should not keep it until next administration as it gets contaminated. You should clean the needle again with the alcohol swab before re-injecting it the following day. Again, you cannot know for sure where the half exactly is. You can use a marker to have a line of the half medication and inject approximately half of the medication today, and the remaining half you will inject the next day. On your left side, you will find a medication called Lupron. Another name for Lupron is Luprolide acetate. This is the only medication that you will acquire from our office directly once you're getting closer to your ovulation. You will also able to get it from your pharmacy of choice if your insurance covers that. The next medications is Ovidril and Lupron. These are our major medications to use during the trigger. You are to take either Ovidril or Lupron or both at the same time, whether it is prescribed by the doctor. on the day of your trigger. Avigil and Lupron you are to take 2 days, which is 36 hours before your egg retrieval scheduled. This is the trigger injection shot that will be administered at the very specific time. The time and the hours of administration you will get directly from the nursing staff once your results reviewed by the doctor. You will take one or both of these medications at the same time in order to induce the ovulation. Timing is imperative with this medication. If you need to change the trigger time, you have to let us know immediately so we can change the time of your procedure. Side effects: redness or pain at the injection site, mild abdominal pain, mood changes, mild nausea or vomiting. Again, not all of these side effects will apply to you. You may or may not experience side effects from Avigil. Ibuprofen, either Motrin or Advil, one of these medications will be prescribed to you during the trigger time. Once you trigger, you have to start ibuprofen, and you are to take 600 units usually every 12 hours. So it promotes the ovulation delay in order for us to preserve the follicle towards the day of the egg retrieval, and it also helps with the pain during the egg retrieval as well, as it has a pain relief medication. Prometrium is the medication that we are using during the embryo transfer, and what it does, it prepares the uterus to support the embryo implantation. The side effects, the most common ones, are headache, breast tenderness, vaginal discharge from the progesterone capsule, hot flashes, and abdominal cramping. All the injections are administered subcutaneously, so the site of the injection you can find around the belly button, 2 to 3 inches away, or you can also use the upper thigh area. You can find all our injection training videos at newhopefertility.com. About NHFC and resources. Every single patient is welcomed to come into New Hope Fertility Center with their medications, and the nurse will gladly help you to administer your first injection in office. We can go over details of the injection, train you how to do injections on your own, and then you can make a decision whether you're comfortable to continue, or you can come in for your injections every time you need to do so. Thank you so much for listening, and if you have any additional questions, please feel free to contact us. Whether you have questions about embryology, PGS, andrology, billing, or all clinical questions, as you can see, you can contact us via telephone numbers or emails. Please press thumbs up below this video so we know you watched it. Thank you, and we are happy to see you at New Hope Fertility Center.